2, 1. Okay, now we have a scheduled C-section time. So now we're going to get everything connected and we're going to get this giraffe ready to use. So the first thing you're going to do is turn your giraffe on. You're going to remove the payment rolls. You're actually going to grab delivery blankets for the delivery room. I did not bring those with me, but you're going to put some blankets in there for the delivery room. You're going to open this bag back here. This is your delivery bag. In this bag is everything you're going to need standard. So you're going to use everything in here. Once this turns on, we'll open the top and get it warming. I don't want to hit you. Okay, perfect. So we're going to get this out. We're going to get our isolation bag out. Now, you would actually be opening this potentially, or at least getting it ready, depending if it's going to be sterile. Kedra has talked about ideally, they're going to keep this sterile so that they can do delayed cord clamping, the provider with the isolation bag. So right now, I guess I would just leave it closed until we know further. You're going to get your suction attached. You just bring this tubing in, and you could attach, there is a 10 French suction catheter in there, as well as an 8. Primarily for small babies, you would use the 8 French suction catheter. You're going to get your temp probe attached here and brought into the room. You have a tegaderm for the small babies to place on the skin, and then your temp probe cover. You have an umbilical cord clamp. Your hats, we have 2 sizes for hats, and then their leads. What you're going to do is open these up, and you're going to get your cables in the bed. And you're going to attach them. Obviously you don't need your blood pressure cable quite yet, but these are kind of tangled up for now. But you get the idea. So you're going to connect your electrodes to that and your stat probe. We have both sizes in there for now. The less than 1.5 kilos. Right here. You look at all those opened and attached and ready to go in your bed with the blankets, just like you would see at a delivery room. Once that's all been done, you're going to bring the top back down, just for travel purposes, but you're going to keep this nice and warm. So now we're ready to bring this to OB, okay? That baby is going to be C-sectioned at 2 o'clock. I would say you want to get this down into the room before the mom gets in there, before the sterile field. That is the ideal way to do this. I do have a checklist here you're going to refer to. We already did the bedside preparation. Now we're going to take a look at the delivery room preparation, okay? So the first conversation that needs to happen with the OB nurse is that they are removing the Panda from the OB room and you're bringing in the Shuttle. Once you get down into the delivery room, you're going to connect your air and oxygen hoses to the wall. And you're going to check all your equipment. You're going to check your T-piece resuscitator, turn on your flows, and set your pressure. Grab your mask, and then you're going to bring swivel this over closer so it can reach the baby better. And you're going to bring this in here. You're going to raise the top up once you get into the delivery room, get everything set, Your suction, you're going to double check that to make sure it's between 80 and 100. And once you're good, you're going to want to double check to make sure all your airway stuff is ready. Get your stethoscope in the bed as well. All these things are listed on there so you don't forget. You can do your double check to make sure you have everything. But you're going to want to get your airway rolled out so that you're nice and ready. Typically in the C-section room there's a shelf for us to lay this on. But as you can see, we have an end title in here. We have 2 of every tube. All the things you would need for intubations. We also have our OGs in here, our RAM cannulas, and our LMAs. So that's all in here. You're going to get out what you potentially think you might need and get that ready. I think that is it. So you're going to assign roles. One other thing to note is for our small baby protocol, it's important for us to remind the OB team that we have to increase the temperature of the delivery room, ideally to 74 or 75 degrees. So that if we have enough time, we can get that done as well. If you are considering bubble CPAP, this would be the time once you get in the room to get that going and bubbling and warmed up, because ideally is to have warm humidified air for those babies. Right now, as you can see, everything, so the air and oxygen is being pulled from the wall. So this machine, the T-piece resuscitator, and the suction is going to run off this. And once you are ready to go, once the baby is stabilized, you're going to need to use the tanks for transport. The tanks will work on either the vent or the neopuff, but unfortunately the tanks the wall cannot support the vent alone. So the vent, if you do need the ventilator for any sort of NIPV or if they're intubated and you want a rate of some sort, you're going to have to use the vent. Otherwise, if you just have RAM CPAP, you could potentially just hook your RAM cannula to your neopuff and run off of here. But either way, you're going to need your tanks for transport, but I highly suggest waiting till right before you leave to open your tanks because we only have 1 of each. When you do decide it's time to go and the baby is stabilized and everything's set and you're going to put them on the vent, you're going to want to open your tanks. I suggest the nurse who's standing over there helps you at the same time because they, like I said, they do make a noise in the delivery room and nobody likes extra noise in stressful situations. So you're going to open both your tanks. And at this point, you can hear the vent is running, even though the vent is turned off. It's going to pull flow no matter what. So that's why you want to wait until the very end to use your tanks. And you also want to note that if you are taking the baby back on the tanks, you're going to want to make sure your suction is turned off because your suction is using air and oxygen as well. So you're going to go through your tanks very fast. If this is left on and you're using the vent. So close your tanks when you are not using them. I'm just going to close them now just for the sake of not having to change it myself. When you get back to the delivery room or to the NICU, when you come back in, you kind of have to, it's best to actually back in. And what you're going to want to do is you're going to want to turn the giraffe off because otherwise it'll alarm at you. So it's nice and maintained heat in here this whole time for transport. But now you have to turn it off so that you can plug it into the wall. So you're going to unplug it from the shuttle. It takes sometimes several hands to get situated back into the NICU. So you're going to plug your isolette into the wall and then turn it back on right away so that you have access to open it when needed. So now you're unplugged from the shuttle. You're going to want to make sure all your cables are disconnected or are coming out, and you're going to plug into the monitor. So you'll pull, meanwhile this baby's being ventilated still. And you're going to plug into your bed spot. This is all gonna be in there still, so you're gonna connect it to the baby. So what you're gonna wanna do is get this out of the way. Okay? Now you're gonna have to connect your baby to the vent that's set up at the bed spot, get those cables in, and then back this up, oopsies, to where you want it. So at this point the suction was left in, so I'm gonna pull that out, similar to what you would do with the cables for the monitor. Get the baby in here. Hopefully your vent is gonna get pulled in over here. The vent that was in standby is now getting pulled over here. This is gonna come up. And we're gonna have access to our baby. And this is where we're gonna do all our admission stuff here. Someone can take the shuttle out, clean that up, and restock it.